So, good afternoon, everyone. Firstly, I would just like to thank the Inga Foundation and I welcome our Pro Chancellor Dr. Mahak Bhandari, our Founder Chairman Dr. Mahak Bhandari sir, and the other guest, Mr. Sunil Chordia sir, Dr. R.D. Nagar, and Mrs. Sangeeta Chordia, Dr. Rajesh Jain sir, and Mrs. Mamta Devra. They are from the Rajatan Foundation. They are the main donors for this particular occasion. And again from the Inga Foundation, Dr. Krishna Rao sir and Chetna K ma'am and all my faculty members, all the students. I just like to welcome you. It's a great occasion because today it's Founder Chairman's birthday, my father's birthday, Dr. Mahak Bhandari sir's birthday. So he is always, as you all know, that he's always keen to do something जो एक वो कहते हैं कि सोसाइटी के लिए कुछ करना चाहिए तभी कहलाता है कि कुछ करा है. So this is his message, that's why we are here for this occasion. So I would just like everyone, welcome to the SAMES University. I am Dr. Mahak Bhandari. I am the General Secretary of SAMES and the Pro Chancellor of Sri Aurobindo University. So I just bring greetings from SAMES. This is a university campus. SAMES is the society name and university name is Sri Aurobindo University. So this is the aerial view. And this campus is of 35 acres and which has got more than around 7 hostels here with a capacity of around 5,000 plus members can stay in this premises. And starting about the group, this is our group. My mother and father started with a dispensary at Pardeshapura, which is our oldest hospital still, which is a 30-bedded hospital right now with a maternity unit. And then we grown up, and then in 1993 we started with Bhandari Hospital Research Center in Vijayanagar. And then we started a insurance company and the paramedical courses, and then the blood bank component services. And in 2003 we started with this Sri Aurobindo Institute of Medical Sciences Hospital, a medical college associated hospital. And then further we started with a nursing college, a dental college, a light health physiotherapy college, the university, and for now we have got the law college also. This I am saying because we just want to tell you that how our group has developed. This is a medical university. It's not a university जिसमें कुछ दूसरे अलग प्रकार के courses हैं, but there are all the courses pertaining to medical field only. And this are group hospital institutions, which is the Bhandari Hospital, Mohak, and there is a skill development academy also, and there is a laser unit, which is a laparoscopic academy of simulated education and research. Then this is our hospital. Just to tell about the hospital, it is a fully accredited NABH hospital with an NABL accredited lab. There are around 1400 beds in this particular hospital with 600 plus doctors and 2000 plus staff working together with all the ICUs in every field, say the medicine, surgical, neonatal or the pediatric. And we are all recognized by all the government units like the Ayushman, ESIC, CGHS, police, welfare, state government, central government. And then Sri Aurobindo Hospital has got around more than 20 plus operation theatres with a center of excellence in robotic and bariatric surgery, with specialized in congenital heart and a dedicated pediatric super specialty department, with a cochlear implant and a speech therapy unit, a dedicated cancer unit with all the surgeries, rehabilitation, physiotherapy units, and palliative medicine and transplant unit. Also, this was the hospital which had treated maximum number of patients in Madhya Pradesh during COVID times. And these are all the super specialties which are located in this particular premises only, with the PET scan, gamma camera, brachytherapy, digital mammography, CT, MR, EEG, molecular genetics lab, and the pathology lab, pain clinics, and simulation lab. So what was our vision when we had planned to collaborate with the Inga Foundation, because there are many foundations which are doing this particular noble thing and with treating the cleft lip and cleft palate and some facial deformity patients. So Inga Foundation has aimed at treating the less fortunate children born with congenital facial deformities. And Sri Aurobindo Hospital, because this particular hospital has got all the specialties under one roof only, because these are the pediatric group patients. So the Department of Pediatrics or the pediatric surgery or the plastic surgery, or in the dentistry we have got the oral and maxillofacial surgery or the orthodontic surgery, all people are located in this particular premises only. So the main intention would be when the Inga Foundation is collaborating with us, then these patients will get the benefit of all these specialties under one roof only. And after, when the surgery has been done, then there is a need of speech and hearing, there's a need of rehabilitation, because we have got our own speech and therapy college. So this would be very much possible for these patients. So this is the upper edge why SAMES is there, because this is located in Indore, well connected. It is in the municipal limits with all the this is a teaching institute, so there is यहाँ पे कमी नहीं है doctors की, because all the people are working here and most of them are staying in the campus only. So there are many doctors here which are working, and what is the university logo with the vision with action, so we can do that in this particular premises in SAMES. And so this I just told you that it's a multidisciplinary team approach for the cleft patients. And just about the short introduction of the department, in pediatric we have got around 120 beds with 30 doctors and 70 nursing staff. So these all patients can stay there in the wards. And there's a dedicated pediatric ICU, because it's an NABH accredited hospital, so you can imagine the level of standard which we can give here, because it's according to the norms. So what we have thought is that 2 ICU beds will be always reserved for the cleft children, and 1 ICU bed will be reserved for the adult cleft patient. Then there is a neonatal ICU, in which if at all there is a patient who has been diagnosed with cleft or craniofacial deformity, then he can be given, and 2 beds will always be reserved for these patients. Then we have got the Department of Oral Maxillofacial Surgery, who will be conducting these all surgeries. All the consultants are trained here. My friends Rahul and Shushmita ma'am, they were doing it regularly, and Rahul used to go to Jen for doing cleft lip surgeries, and he was doing the surgeries in CHL also in the Smile Train project. And now we have got the dedicated cleft consultation room. A separate room has been designed for these patients only in our OMFS department in College of Dentistry, and then they can take the help of the orthodontics department also, because the consultants are trained in that. And I would just like to add that I was just saying that we have got a dedicated simulation lab in which we do teach and train the surgeons also how to do the surgery on the cadavers also, so they can very well learn how to do these all surgeries and how to go ahead with the patients if they get these kind of patients. Then recently we have started with a Department of Digital Dentistry, in which there's a 3D printer. I'm not a dentist, so what I know is that they can, because of this technology or the artificial intelligence, now you can create the images and you can get what we have to do for the patient. So there's a digital dentistry department in this particular dental college. And then we have got the speech and language therapy college, in which the patients can be taught and then they can be rehabilitated. So these are some of the glimpses of the cleft patients operated at SAMES. So final words is that what I told you, that SAMES would be helpful for these all patients, because all these specialties would be there and there would be all the doctors who can take care of these all patients. And so we are very much delighted, we are elated to announce that the collaboration of SAMES and Inga Health Foundation for treatment of these all patients. So thank you very much, and thank you for the patient hearing.